My name is Dr. Frank McMillan Jr., Chair of the North Andover Board of Health, and we're going to call the meeting to order for January 24th, 2019. It is 7:02. This meeting is being recorded for all present. The first item of business is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item of business is the approval of the minutes, which were distributed previously. Are there any corrections to the minutes?
Minutes have been critiqued, and I make a motion to approve the minutes.
Can I have a second?
Second.
All in favor? Aye.
Aye.
Any opposed? No. It's unanimous. The ayes have it. The meeting minutes are approved. Next item of business is public hearings. There are no public hearings. Next item is old business. There is no old business. Next item of business, I'm going to go out of order, and I'm going to introduce our newest member of the North Andover Board of Health and try not to embarrass him too much. So for those of you who do not know Dr. Patrick Scanlon, Dr. Scanlon is our newest member. He was recently appointed and sworn in by our town clerk. He is a physician practicing at Dartmouth Hitchcock in Manchester, New Hampshire. He is a specialist in pulmonary and critical care medicine. Prior to becoming a physician, he also served as a firefighter and a paramedic in New York. His wife is Kristen. He has 2 children, a son, Charlie, who's 2.5, and a daughter, Madeline, who is 3 weeks old. There is also, by report, a cockapoo named Martini.
That was my wife, not me.
Not a very manly-sounding
No,
name, but
no, that was my wife.
anyway, welcome to the board.
Pleasure, thank you.
Okay. Next item of business, we have some new business, but I think what I'm going to do is I'm going to skip forward to TBI. Mr. Thompson.
Frank, this is for you. He just submitted these tonight,
Okay.
so take one, pass it down to Tony. And I'll let Jeff just take over and start explaining to the board as to what we have here and reiterate what he's talked about in the past before you guys as well.
Right.
It's similar to the prior times I've been in front of the board. We are looking to put up a few temporary structures on the site. One would be for clean wood, which is wood that is not commingled with construction and demolition debris. It would be, at times we get trailer loads of pallets, or we get trailer loads of crates of big wooden boxes. So those things, they're not mixed in with C and D, so they're already clean wood. And then we're looking to put that temporary structure for the storage of our processed unpainted wood outside of the envelope of the existing building. The second structure at the west end of the facility that is noted on the plan would be for the post-processed non-recyclable material that would be contained within a polypropylene bag, so it would be baled and bagged material. We're not looking to expand the waste handling area, so there would be no storage of material that would be incoming to the site within either of these structures. It's only for temporary storage of material, wood that is going out for further reuse, or the post-processed non-recyclable material that would be baled and bagged and just stored on site until such time as transport would be able to load it and get it off site. You know, the reason why I'm here is I've been in contact with the DEP. We're in a renewal time period. The DEP at other facilities has allowed that processed wood to be outside of the existing structure. what normally, in our case, is the 30,000 square foot building, as long as it was contained. In this case, because we're on the site-assigned property, it makes no sense really for me to go to the building department, go to the other boards planning, go through the process of trying to site these two temporary structures, and then have to come to the board, and the board could either choose to do it or not do it. It seems like it makes sense to not get final approval, but to get an initial approval, conditional approval from the board that we would not be looking to expand the waste handling area. This is not a modification of the site assignment. It's really just an operational change that would allow us to store the processed wood that we really need, because the locations where we're sending the wood out to, when they have a problem, a shutdown, the wood material starts to back up on us, and so it would be nice to have some additional storage capabilities. So that's what I had provided the board of, what the structures would look like, how they're made, and then just a proposed response from the board so that I can go along to the DEP, and then I could, if the board agrees, that I could then start the process of planning, building, fire department, and get those approvals, but not looking to install anything without having finally come back to the board again to get final approval. That's all I'm looking for.
This is a follow-up of a presentation you gave earlier last year.
Yes, yes.
Any changes since that time?
No, it's the same type structure. The one on the east end of the property would be that fabric structure. The one down the west end, as one of the pictures would show, would be, it's more of a steel structure. I don't need the extra height, and it was made more sense for me to do that Quonset. I really, especially in a day like today where it was so windy outside, having that structure down the west end would make my drop-off recycle area significantly cleaner. Where JRM used to take the recycling, people could show up and the recycling would be contained within bags, but now the Greenworks doesn't take plastic bags, so we cannot have any bags in the recycling. So when residents are showing up to drop off recycling, it's in a bag, they walk over to the container, shake it out of the bag, and it's in the containers. And windy day like today, we'll have some cleanup tomorrow.
I just want to be sure that I understand. You're looking for conditional approval to start the process of planning for the proposed modifications as noted in this letter dated the 24th, that is today, from Attorney Kevin Foley. Is that correct?
Yes. Yep, just
Nothing more, nothing less?
Nothing more, nothing less. Just that if the board is on board with going down that road, that's it. I would always have to come back to you. Even if I got everybody else's approval, I would still have to come back to the board to get final approval.
I don't have a problem with this.
Any other questions? Brian, you want to weigh in on this?
I haven't had a chance to read this yet, but in our preliminary discussions as to what he's proposing, it does fit with what his site has been assigned by the board in previous years for their site assignment. It doesn't change that, so I don't think it's anything that would be a major hiccup in terms of a future board approval. I haven't checked with legal on this. I haven't compared it with the site assignment. I haven't done the backup work because we just got this tonight, which I will do, but I think it is consistent with the use already approved on site.
Okay. Are there any other comments to be made? So my question, Brian, would be, so there's nothing in here, at least on a very quick, very cursory look, that would put us outside of our site assignment regulation. So we're not going to take a vote on this because we can't do that. This is not a public hearing. This has not been posted. But we have heard this before. My feeling is that there probably wouldn't be objection from this board to going through, but we'd have to do our due diligence.
Correct, exactly. So like I said, I haven't vetted this with legal.
Yeah.
I just got this letter tonight, I haven't read it, but that's the next step. But just a superficial look at it and what you're talking about, I think is consistent with what you guys already have approval for.
Could I just ask, is it possible that Brian could shoot me an email so that I can forward it down to Northeast Region Rep?
Just for DEP?
Just the DEP, that's it. Mark Fairbrother, who's the Northeast Region Chief.
Okay.
Just that the board is taking it under advisement, that we posted
Yeah,
a...
we're going to need to hear this again and post it properly in order to take an actual vote to pass this, but this is not the first time we're hearing this, but at the same time, we haven't not really gone through the letter from your attorney.
Fully understand.
So I think you could take that, the mood of the board is generally not going to be adverse to you doing this, as long as we satisfy our due diligence.
Sounds good.
Is there any other comment?
I just have a general comment. How are you surviving? Because the recycling business is not doing well, especially since China
Yeah.
isn't taking recyclables nearly to the extent that they have in the past.
Yes, that's
So
what-
a lot of recyclables are just landfill right now. I mean, people across the nation feel warm and fuzzy, we're recycling. Well, guess what? They end up in landfills quite often. How are you surviving all this?
Well, the good thing for us is that's not the recycling business part of it that we're in.
That's
The-
good.
The residential recycling is not what we do. North Andover is a commingled, everything gets thrown into one receptacle or one truck, and then it goes to a sorting facility, Greenworks down in Peabody.
Oh, so you don't do that here at
Oh,
your
no,
facility?
no, we're construction and demolition recycling.
I see.
So as long as there's a construction boom going on, there's always a need for what we do. That part of the recycling business, yeah, it's very difficult. A lot of material in this part of the world was being sent to China. The problem was unscrupulous recyclers were mixing in a lot of trash and a lot of other debris that was not recyclable. So when you're sending container ships of recycling, baled recycling over to China, the Chinese eventually got to the point where they just said, if we find any material, a certain percentage in that container ship that is unacceptable, we're rejecting the whole container ship.
Yeah,
You
that
can-
certain percentage is greater than 0.5%.
They don't fool around anymore with the recycling. Unfortunately, there were a lot of companies that were using China as a dumping ground and just getting rid of not just recycling, but other stuff that was not recyclable. I'm sure the doctors have seen articles where a lot of that hazardous material was being mixed in with the resin plastics, and we were coming back to this country, even in items that were made for children. Especially babies, who stick everything in their mouth. So that's one of those cases where we reap what we sow when we were sending bad material over there.
Yeah, I had been on the mistaken assumption that not only were you handling C&D, construction demolition material, but recyclables too, so I'm glad you're not.
We host the recycling area
You
for the
host,
town.
but-
We pick it up and we bring
I
it
see.
down to Greenworks down in Peabody.
Got it.
Where they, that commingled material is then through mechanical means separated out. But, there are towns that still have the dual stream where people put paper and cardboard in one receptacle and then everything else in another. And I think that type of recycling is still doing well because it's separating the cardboard and the paper, which is always easily reused, just in this country, that it doesn't have to go over to China.
All right, is there anything else? Thank you, Mr. Thompson.
Thank you for taking me out of order, Dr. McMillan.
You're welcome. All right, so we're going to move on to new business. The fee schedule for 2019. Brian?
So these are the fees we've had set in previous years. I think we raised them a couple of years ago, so I didn't raise anything this year. The only thing that I do want to note is all of the food permits. Megan and I started, must be 6-7 months ago, on revising the entire food application process. Basically condensing all of these different food permits and condensing them into a smaller number that were more general versus more specific. So
Right.
retail would be retail, food service is food service versus the different types of things we have it broken down in. So we haven't finished it yet. The state adopted the 2013 Federal Food Code back in October. So half of the work that we had already started on combining and redoing the plan review applications and the food permit criteria has been changed slightly, and we're fitting it into the new 2013 Food Code. So a little setback, but these are the fees that we have now. These food fees will change. When we get that finalized, I'll bring that back before you, but until then, this is what we have for food permit fees, as well as all the other fees that I recommend you adopt for this upcoming fiscal year, or calendar year.
Can you just explain to some of the members who are new, what happens to the food permits? Where do they go? They go into revolving funds and things of that
Correct.
nature, so they stay within the department, so to speak, and they
Yes.
fund our activities.
Yep.
So if you could just go into a little bit about how that works.
Yeah, so with us being a very small department and limited staff, we have a really good food permitting, an amount of food permits we issue every year. So to keep up with the state mandated inspections, which is 2 per year per establishment, we use an outside consultant to help augment our existing staff with getting all the food permit applications inspected and permitted. So these fees go into what's called a revolving account. This money is set aside that pays for our subcontractor to do all of the inspections, plus programming fees for supplies, inspection forms, things that we would need to do our every regular day food inspections. So that money stays within the department, is used by our consultant and us on a regular basis. One of the things that we were doing when we were condensing all of these food fees was making sure that the categories we created didn't take away from the overall total sum of the permit fees we get every year, because we have to actually pay for and fund our inspections. So condensing, I think there's 23 food categories here, down to 9, is a daunting task. It's just about completed, but comparing the existing fees with the new proposed fees is actually going to be an equal sum. So we're not going to lose money or gain money. It's going to basically stay status quo to be able to fund our food program. So food program is actually very important in what we do, only because everybody likes to go out to eat, and we want to make sure that everybody's getting safe and sanitary food.
Brian, are all food establishments here in North Andover back in service, or any of them still down because of the gas explosion?
Everything's back in service. The last one was just off on School Street here. They just reopened a couple weeks ago.
Anybody not ever reopened?
No. Everybody reopened. Yeah, but it's been a long haul, and some restaurants had to do a lot of basically jumping through hoops to get back up and running. There was one restaurant that completely converted over from gas to propane and changed out all of their equipment and everything, but they're back up and running within 2.5 weeks.
Any other comments, questions? We need a vote to accept this, right?
Yeah.
I will entertain a motion for that vote.
Make a motion to accept the permit fee schedule as presented to us.
Is there a second?
I'll second.
All in favor, say
Fall right
aye.
into it.
Aye.
Aye.
Any opposed, say no. The ayes have it, it's unanimous.
Okay.
The fees are accepted.
Just to expand on this a little bit, the septic construction section of the permit fees we have here, that also goes into a revolving account. We have Mill River Consulting, which does a good chunk of our septic inspections and plan reviews. There's a lot that goes into the entire process, from design, approvals, inspections, and completion of a septic system. So we augment this with another revolving account that helps us hire outside consultants to help us with the engineering, the plan reviews, and some of the inspections. So we do some in-house inspections and plan reviews, and some we sub out to our subcontractor, which is Mill River, who's been with us for, going to be going on 14 years at this point.
You and your department continue to do a good job in presenting to the board and others in town information that is of concern. Like this past week, we had info on septic systems, followed by your write-up
Thank you.
on septic, which is very, very good.
Thank you.
So if anyone here in North Andover has a septic system such as I do, please review what you put together. I went online, I did not see it. Is that available online?
You know what, I thought it was. I can make sure it's up on the website.
Yeah, I could have missed it, but
Okay. Thank you, thank you. Yeah, we'll make sure that's up on the website. I know we did get it out there, and it was sent around, and it was in our office. I'll make sure it's on the website as well.
Okay, we're going to move on to the next agenda item. Caroline, you're up.
All right, so we had on January 10th, Dr. Pody come and speak at the high school on addiction and the adolescent brain, and we had the North Andover Police Department come and set up their in plain sight display for adults to kind of walk through and ask questions about certain paraphernalia that they might find in their teen or tween's bedroom. So we had a great turnout. We had the youth center come and do a child watch for us. So for anyone who wanted to come and maybe didn't have anyone to watch their kids at home, they were available. So it was a great collaboration with other departments, and we had, I think, well over maybe like 150 people there. Someone said 200, I don't know. Yeah, so it was a great turnout, and we were able to post her video and slides on the health department webpage, so.
unfortunately, I wasn't able to make that presentation, but I did go online and look at it. It's available, well, you can download, you can ask your cell phone, or just type into your cell phone or your home computer, presentation on adolescent brain in North Andover given by Dr. Ponte, and there it is.
Yeah.
You can ask it in a lot of different ways.
Yeah.
It's a little over an hour, but it's absolutely riveting. It's by far and away one of the best presentations that I've ever heard. And I just want to highlight a couple items, because again, it was on the adolescent brain. Opiates in the U.S., number one cause of deaths for people 50 years old and younger. E-cigarettes, explosion in use starting in the summer of 2017. And kids at a very young age are becoming addicted and are addicted. Marijuana, in-depth study in Australia. It's a Schedule I drug, so we don't have, from a federal perspective, an in-depth study here in the United States. At least I don't believe we do. But there are such studies in other countries. And the information there, and it was really an in-depth study. And they're talking about young people, heavy users, 8% reduction in IQ. Heavy users, only 3% of college graduates. Non-users, 30% of college graduates. This is an old study, goes back 10 plus years. And at that time, marijuana was a lot less potent than it is right now. So the problem has only gotten worse. Cognitive abilities, heavy user, it diminishes your cognitive ability. It doesn't enhance it, it diminishes it. So I'm going to watch it again, but it's very, very good, and I highly recommend that anyone that has interests as such look at it. She even went into detail as far as what the state is doing about addressing some of these problems. Excellent, excellent.
Yeah.
So, would be nice if we can have her here sometime as a speaker at our board.
I know the schools we're talking to, they'd love to get her back to try to do something either with, a younger population. I'm not sure, where they're at in kind of trying to figure that out. But I think she's such a powerful speaker that I think even having her on a yearly or, every other year basis is just to kind of capture other different audiences. I think she just does a great job of presenting the information.
Yeah, and she was introduced by Brian. I didn't recognize him because he was all dressed up. But after a while, I said, hey, that's Brian. Oh, that's our Brian. Damn.
Thank you.
You clean up well, Brian, by the way.
I tried. I always had him convince you to wear a suit since the meeting.
I know. I'm gonna show up in a tux.
I was present at the meeting, and I've been to some of the finest lectures anywhere, and this was really, for anybody in the audience who has any curiosity, I guarantee you will not be disappointed. This is, if you thought you knew something about addiction, you're going to know so much more. This is, I can't give it anything other than my highest endorsement. It's available, absolutely watch it. It'll change the way you think about addiction. It absolutely was a fantastic talk given by a great speaker who is very well qualified to give the talk. I mean, this is a person who works in the prisons. She's the medical director of the Franklin County Prison, I believe.
Right, and then I think the opioid task force as well.
I was blown away by not only the content, but just the way she delivered it.
Yeah.
It's definitely highest recommendation to watch it. The fact that we've got it.
And it's going to be around forever.
Yeah, she was very vocal about just like spread it, use the
Spread it.
slides. show the
Anybody who's got a
videos. She
parent
just
in
wants to
elementary
educate
school or
people.
middle school needs to watch this.
One of the things that she said
Absolutely, yeah.
is that if you have a child that's addicted, you put him or her into a program for 5 days or so. She says it could even be counterproductive. She says it takes a long, long time. And I was thinking, Frank, of what you said last year, rewires your brain.
Yeah.
And it takes years, 5 years, if not longer, to really act normal and be normal.
And even then, there's always a risk of
Yeah,
relapse.
yeah. She also commented about dysfunctional families. And she said if someone really is from a dysfunctional family, it's going to reduce your lifespan by 20 years. I'm saying, whoa. So, and she had data to back up what she was saying throughout.
Yeah.
All right. What else are we doing?
So blood pressure clinics continue. We are headed to the high school's health expo on February 5th. I'm going to do blood pressure screenings there. They have a ton of vendors. Lawrence General Hospital is sponsoring the event, and that's Tuesday, February 5th from 10 to 1. That information is also on the website. We finally have Shingrix, and so we are just working on the funding piece of it because of the insurance coverage and it being a Medicare D, and so we're trying to figure out how to get the cost down for the seniors so they don't have to pay a lot of out-of-pocket costs for the vaccine. Still doing communicables, a couple of meetings, and I think that's it. And then we have a blood drive on Saturday, February 23rd. And that's it.
It's awesome. So, we do have some housekeeping to do. We have to appoint our agents for the year, right? This goes until our first meeting of January 2020.
Pretty much, I've never heard people get unappointed.
Right.
But I like to just do it every year just to keep it clean.
It's
and neat.
clear, it's in the minutes.
Correct. Yep.
It's legal. So, you all have in front of you a list of appointments. I'll just go ahead and read them for the minutes and for the audience listing. The board proposes the following slate. Brian LaGrasse as Director of Public Health, Caroline Ibbotson for Public Health Nurse, Tony Wolfenden as the Health Department Assistant, Ron Beauregard as our Tobacco Task Force, Tom Carboni, Acting Agent, Director of Public Health, Joyce Bradshaw, Town Clerk, as our Burial Agent, and Catherine Kozakowski, Animal Control Officer and Animal Inspector. The slate is in front of you. Is there a motion to accept the slate?
Just a quick question. Tom Carbone, he's the Director of Public Health in Andover.
Correct.
If you were unavailable, for how long would he come and fill in?
If I was on vacation and away and couldn't respond to something, he could be my backup. And we have mutual aid already in place for public health with our local public health coalition. So we have signed MOUs with the town administration of 8 towns around us. So if there's a backup that needs to happen, if I'm unavailable or incapacitated, you do have that option. Tom has always been the closest as a backup if I'm away or incapacitated for any reason, that staff here could call and ask questions, or he could come out and actually respond. Part of what this is appointing agents, is you guys as the board are given statutory authority to govern and administer the housing code, the food code, environmental codes, your local, public health regulations you guys have in town. You guys, statutory authority, have you guys are tasked with basically enforcing those rules. As an appointed agent, you give me that authority to enforce that while you guys are off doing your...
Not in session at a meeting.
Correct.
Right.
So this is just housekeeping. Appoint your agents that can carry out your policies and your regulations, and bring stuff before you and act as your professional staff. So it's myself, Caroline, Tony, Ron, who's our tobacco control agent. You guys have met before. Who that you will meet. He'll be back before the board. Tom is a backup in case I'm out of town and Caroline needs help or needs a response. Like if we don't have an inspector hired yet, he could act if I was obviously not here. And Catherine Koskowski is the animal control officer and now our new animal inspector. So she does our rabies quarantines and barn inspections and things like that. Now that the town has moved on from Dr. Lindsay, and now we have both of these positions in-house full-time. So there's a little background as to why you guys appoint us as your agents.
Because we have day jobs.
Yep. So yeah, any questions?
Any further discussion or questions?
Make a motion to approve the agents for the Board of Health as described.
Is there a second?
Second.
It's been moved and seconded. All in favor, say aye.
Aye.
All opposed, say no. It is unanimous. The agents are appointed. Correspondence.
Correspondence. A couple things. One of the groups that attended our Dr. Pody presentation is called MVP ASAP, Merrimack Valley and Prevention and Substance Abuse Project, who does a lot of nonprofit work on substance abuse and addiction. They are sponsoring a theater group called the Improbable Players next Thursday night. And what that is, it's a theatrical performance that kind of goes through the addiction process and the effects on the addicted and the circle around them, their family and friends and things like that. So great performances. They do it all over the state. They've been in this area before, but they're actually having a performance at the high school next Thursday night. So the MVP ASAP group is having their general meeting at 6:30, and then they're having the Improbable Players do a performance at 7. So I think it's really moving. It's a great thing to see, just to see how it plays out. And all of the actors performing in the performance are all in recovery. So they're all recovered addicts who are now doing something to help shed light on it and show people what actually happens through the whole process.
What does it take to see it? Just walk right in?
Yep.
Have to show any identification at all?
Yep, come on in. It's in the auditorium where the
Social
last
security
presentation
number.
was.
What time did you say, 7 o'clock?
Maybe a
7
date of
o'clock
birth.
next Thursday night, January 31st. So I just wanted to give them a plug on that. I am very involved with that group as well.
Bank account number.
Are they advertising it all? I haven't seen anything.
They have, I believe they will be getting out more. I think I also want to get it out onto our social media as well
Right.
next week, and hopefully people can make some time to go take a look at that.
Where is it being presented?
The high school. Yep.
Caroline, you mentioned this Health and Fitness Expo.
Yes. So the high school's putting that on. I think they put one on like 3 years ago as well. So Lawrence General is sponsoring it, and they have a ton of vendors coming. And I think all the high school kids are going through it, but it's open to parents, adults, seniors. So it's circulating on the town website. There's a Facebook event for it that they've put out there, so.
Okay.
One thing I did want to pass around, I just printed this out tonight. This was on that MAHB email that you sent around. This is actually the Senate bill that they're talking about. I just printed it out tonight and just took a look at it. If you guys wanted to just take it home, take a look at it. I think what it's trying to do, essentially, I gave it a quick peruse once over, is trying to strengthen regional public health initiatives. So some of the areas that don't have adequate staff can basically share resources and kind of increase their public health capacities.
Yeah, I read it, and obviously, I mean, we're not in a position to vote on it. I just got it yesterday.
Yeah.
It is of interest. Within the information that's provided, they talked about 5,000 bills in the 2019-20 legislative session in the Commonwealth of Massachusetts. And because only in session for 60 days a year, that's like 85 bills or so a day. So it says to me that there's no way that they can review all these bills, but that's a different story. But 5,000 bills, it's unbelievable. And this is one of the 5,000. And basically, as you said, it does talk about regional public health systems too. Knowing full well that in Massachusetts there are 351 cities and towns and villages, and some have very limited boards of health at best, and there are different standards and so forth. So trying to make things more uniform. Two things that really stand out in this to me, and certainly warrants further discussion going forward. One, the new bill will ensure all members of the local public health workforce have access to essential training. I believe that includes members of boards of health too.
Yes.
And number two, create an incentive grant program to support more effective and efficient delivery of services by increasing sharing across municipalities. Perhaps that's something that you would be in a position to talk about, maybe not now, but sometime going forward.
Yep.
So, yeah, it seems reasonable. I doubt that all legislators will read it, because they have 4,999 other bills to read, but nevertheless, it sounds reasonable.
I think the ones that gain traction go further, so we'll see.
My take on it was that there's a lot of motherhood and apple pie, and my only concern is whether there is a downside to regionalization. Does that mean does it take some control away from the local municipality? If you have a regional health board, do some places become more important than other places? And so I think what the ask from the Mass Association of Health Boards is that if we would go individually to our state representatives and senators and request that they co-sponsor. So that was really the ask. This is going to go through a process. This is going to go through it'll go through hearings and a committee and things like that. It'll get voted out favorably, unfavorably. The reality in the life of a piece of legislation is very few things will get passed in the first year that they're introduced. They usually will need to go out, be discussed, get studied, and they need to be refiled year after year before you actually get action on them. I don't think that what she is asking for is an unreasonable ask, but you know, it's kind of hard for me to call somebody up and say, would you support this, if I don't really understand it as well as I feel it needs to be understood. So maybe this year we could see what happens to it. You know, Chuck, you know, anybody is free to look at it and call up, you know, Senator DiZoglio or Tar or our representatives, Representative, I've forgotten her name, she's new, and Minicucci. There's two of them. So anyway, do with it what you want.
When I first read this too, I had your sentiments. I said, well, is there a nefarious reason for this? Because I know that the state in the past has talked about regionalization. And they mentioned that here. So this may be a way to open the door further towards regionalization. I don't know, but I had also thought about that when I read this.
There's been legislation passed in Mass General laws that does allow for avenues to regionalize. I think it's not geared for someplace like here necessarily, because we have a solid board, we have neighbors that also have solid boards, we have staff, but some of the other places in the state don't. They have regional boards and very limited staff, and they may have one septic inspector for 3 or 4 communities. And it's a way to get that a little bit more broadened, maybe get some extra resources in there to have a food and a septic or 2 septic inspectors for those association boards, basically. If we were going to do anything with the regionalization here, we would need additional staff because we're spread basically to our breaking point now with everything that we can handle. To take on more and to help out another town, we would need additional staff. So there's a give and take there. So if we say partnered up with a smaller community in the area, I won't name any specific communities, we may have to give more than we receive in terms of assistance or inspections or time. But if there's a way to get funding with the regionalization and regional positions, maybe having a floating food inspector to help augment 3 or 4 different towns with state funding, then that's something that definitely would be of interest.
Any comments? Questions? This is our place to ask questions, so this is, we're really towards the end of the agenda. If there are issues that people would like to bring forward just to discuss, we can't vote on them because they're not posted, but if there are items that people wish to bring up. One thing that I'd be curious as to is what's gone on in the health department since the last time we met. What are we doing? Are we doing late septic installs, or what's going on?
We've got a couple late septic installs going on right now. One of them is finished up. I'm going to be doing a final grade inspection tomorrow for Bannon.
Yeah.
Talked to Keller today.
Okay.
And we have one finishing up right now for failed systems that were going through transfers that started the process a while ago, but going through the review and the approvals or starting it late. Our septic season closes at the beginning of December. So to alleviate any winter construction that does affect the construction of a septic system, we try to limit them to only emergencies. So we've had 2. They're both finishing up now, which is good. And then we shouldn't have anything else for septic until March is when we open the season back up. So mid to late March, depending on weather and how much snow is on the ground and what the...
When you're
weather
talking about
patterns are.
emergency, you're talking about a failed septic system.
Yes. So if it's failed and not protecting public health, then it's better to start the process now and make sure it takes longer in the winter, and you have to take additional steps to make sure that frost doesn't issue or impact the system at all. Heavy snow mixed in with your system is a bad thing. You can't have that happen. So you gotta look at the weather and kind of plan it out as best you can with winter weather and storms coming in. But
Right, there are things just like the final grading and the seeding and things like that you really, can those things be done in the winter?
yes.
Okay.
Well, grading, yes. Seeding isn't going to take until the spring anyway.
Right,
So there are certain things you can kind of push off, but you want to get the system constructed and functioning and covered as best you can now. And then in the spring, hydro-seed it or hand-seed it and let it revegetate and kind of grow back and stabilize itself.
So if you have, say, a brutal period during the winter, and you have a septic system, and say the distribution box plugs up, and it backs all the ways up to the septic tank, what options do people have?
A D-box is a quick, easy repair. It's the leach field and getting your different layers of materials in. Your septic sand, your stone, your pipe, your pea stone, and your material cover over the system. You want to get that in as fast as possible in the winter and make sure that it doesn't freeze, doesn't get wet, heavy snow mixed in, because that will throw your elevations off a little bit, and you don't want that to happen at all. So you got to make sure it's done quickly in the winter if it's an emergency. But a D-box, that's a quick, easy repair. They can do that with a 3x3 hole. Go down there.
Good luck getting through a couple feet of snow as last winter.
Yes, but it's doable. Something like that you can do an easy quick. That's a minor repair. It's the entire system you don't want to do in the winter. So aside from the septics going in, I'm working with Megan on the new plan review guides for our new food permit criteria. We are actually looking to implement trainings for all the establishments this spring on the new 2013 food code. So we were working off the 99 food code since probably around 2003, 2004. The FDA has gone through several revisions since then. Pretty much every 2 years, they issue addendums and revisions to the food code, and it changes. Massachusetts just adopted the 2013 food code, even though they're on the 2017 food code. That's okay, we're making progress here. So with that, all the revisions in between 99 and 2013 have to be incorporated all at once. So you're changing hot holding temperatures, you're changing procedures required for restaurants to have in place and plans in place for norovirus or vomit cleanup spill plans, and all sorts of things are now being incorporated all at once. So we're going to have some trainings for all the establishments this spring with Sweet Safe coming in to do, I think we're looking at least 6 different trainings. So 3 on one day, 3 on another day, hour and a half trainings basically. And we're looking to make it possibly mandatory for every establishment to send somebody to these free trainings or hire them to come to their own establishment and do their staff.
What if you've already
So-
been certified?
Excuse me?
So what if you've already been certified? Like, I've been certified. I was
Correct.
certified years ago.
This is...
Would I have to be recertified on that, or?
Nope. This is to get updates and get exposed to the new food code. Because 14 years of no updates all at once kind of hits you pretty quick.
So that'll be
There's a lot of
noted
stuff.
in training going forward then?
Correct. Yeah. So we're trying to plan on that right now. Working actually with Andover and Tewksbury on getting the same curriculum together with their consultants to do the same training in all 3 towns for 18 different time slots if they want to travel to a different town. But we're going to offer it here, Andover and Tewksbury. Same curriculum. You might have different consultants doing it, but at least it's going to be the same class. So hopefully that
Any
gets...
fee for that?
No, this will be free. Mandatory, but free. So we're working out the kinks and trying to get everything lined up for that. We are in the process of looking for a new health inspector. I've gotten some pretty good resumes so far. I've got probably about 8 right now. I'm going to probably print out the rest of them tomorrow, start reviewing them this weekend or next week, and start scheduling interviews. So being short-staffed is not fun. Aside from that, anything on the permitting side, viewpoint?
It's going well,
Okay.
yeah. Learning, it's going good.
Okay.
So usually the things that come up this time of year for those who are new, trucks, trash trucks. So
So we have animals, dumpsters, food. Trash was December. So was septic inspectors and septic installers.
and upcoming, we have pools, mosquitoes, summer camps,
Tobacco.
and tobacco. We have a new director of community development who's going to be joining us at the next or the following meeting.
I'll nail down a date with her.
Okay.
Also Deanna Cruz as well.
Yes, we have a new social worker in town,
Correct. It's a
Yeah.
community support coordinator.
community support coordinator. She's lovely,
Yes.
and I took some time and went and met her maybe 2 or 3 weeks ago, and so she's on the invitation list, and so is our new community
Yeah.
director,
Yeah.
community development director.
It's deputy town manager too.
Deputy Town Manager,
Yeah.
yes. And what about the mosquito district? Are they going to have a little time to talk to us? We have a deadline in March, right, for people to opt out?
People can actually contact the town clerk's office to opt out of their property being sprayed. So if we're going to do a town-wide spraying for West Nile virus or Triple E, they're going to blanket the town, basically every street, unless you opt out. Then they'll stop the spray, the foggers, in front of your property so you don't get sprayed.
You can do that online, too. Yes?
Can you do it on
No?
mine?
Yes.
Yeah.
You can. I
Okay.
thought you could, yeah.
And what's the deadline if somebody wants to opt out? It's
I
very
can-
early, it's February.
I
Yeah,
believe
it's
it
March.
is, yeah, or like March 1, but I'll double check
March
with
1 or March
Joyce
10.
to.
Right, and there's a
confirm.
reason for that, and it's because the mosquito district has to program the addresses into the trucks. We
How
mostly
would we
use truck
notify?
spraying, and so if they need to be ready to go, and they're not gonna sit around there and reprogram things. People call in, it's like, don't spray my yard, but we encourage everybody to not opt out, because it reduces the effectiveness of what we're trying to
Correct.
accomplish. This town has always at least as long as I've been around, is we've always taken a very conservative approach to this, is we really don't spray unless there's a positive test result.
Right.
But you can still request a spray going forward.
Correct. Through our department, you can call and request a spray for your area. Depending on the need, depending on how many people from that particular area want to get done, we can do like a street. If there's a localized positive for West Nile virus, we'll do a localized spray usually, and that's up to you guys to decide and figure out at the time or when it happens. And I usually work on that with the chairman at the time. So I'll call you up, we got a hit at this location, this is what we're thinking, this is what mosquito control thinks, and then we kind of debate back and forth as to that. But if there's a few hits in a row, then we'll do a broader area or even townwide, depending on the severity, the number of hits in the area surrounding us, in other towns, and then obviously if it's Tripoli, it's a little bit more serious. So we take that and weight that a little bit more.
Now, I know that the depth of penetration does vary by wind, but is there like a norm? Because where I live, there's some people that actually raise bees. And,
Correct. Bees, luckily, are in the hive at night, and the spray won't penetrate inside the hive,
oh,
so they should be protected. We've gotten that question on several occasions, and if people are really worried, and if they do have bees, they can cover their bees with a sheet. If it's really hot out, you might want to kind of temper that, because heat can affect the hive. It can hurt the hive. So depending on the temperature, depending on how your hives are stored, how your boxes are, if there's protection around them, people can cover them for the night. It's not too hot out, and there won't be any issues, but it will protect them additional from just being inside the hive. I did get an email from them today. They just sent out their vector management plans and everything as of about 4 o'clock this afternoon. So, haven't read them yet, but I will.
Hot off the press.
Hot off the press, it's that time of year.
All right. Is there any other business? There being none, your chair will,
I make a motion to adjourn.
I'll second.
it's been moved and seconded to adjourn. All in favor, say aye.
Aye.
All opposed, say no. The ayes have it, we are adjourned.